saying there are things that are being done, and we will get back to that situation to look at what needs to be done so that we can remove this pressure. The numbers that are increasing in Nelson Mandela Bay need to be understood in the context of where we need to be relieving. Part of the problem is the area of the triage area, and from what I'm hearing, it looks like that one needs to also be given attention to so that people are not kept in the observation ward much longer. Last week, when we saw that as a problem, we actually brought in additional staff from the laboratory so that the turnaround time for the test must be quicker, so somebody doesn't spend a long time. As soon as we know they are COVID positive, they can be moved to another hospital so that the place doesn't get to fill up. But doesn't have to be, that doesn't give an excuse for anything that's unacceptable. We have to know that lives of people are sacrosanct, and everything needs to be done to save their lives. It's also with the nurses and the doctors, their concern when they've got this pressure, we need to be able to accept that more needs to be done to give them support.
Are you going to be asking for more money from Treasury?
Well, we have to look at all of the possibilities, because the question right now is also going through the province. Have they used all the money? Are there any outstanding funds that can still be utilized? Is the problem lack of money? Is the problem planning? Is the problem organization? All of that you see when you get in there. But when the wave is starting to rise the way it is doing now, I think we need to understand that it does overwhelm. And from all this time, what we've been working on is to actually make sure that there's proper distribution so that people don't get stretched in one area. We went through the same thing in literally all the provinces, because first you need to be able to match your logistical system to move your patients to the rate at which your numbers of patients are coming into your hospital. If you run short, you then end up with one side or swamped by patients, when in fact your system needs to be able to move patients to where there are beds available. We did that in Gauteng, we did that in the Western Cape. There is a system where you end up with bed availability bureau that allows you to know where to move the patients. They don't have to fill one place.
Minister, finally, I'd like to get a message from you, from doctors and nurses who are exhausted, who are, as Mark Haywood says, our absolute heroes, who stay in a failing system despite all the difficulties, but also to the community service doctors who are unemployed at this moment, who are hoping for employment. What is your message to those who really want to heal and help, but somehow the system keeps thwarting them, to the point sometimes that they just give up and leave South Africa or change professions entirely?
Well, let me talk about those who are here in South Africa, because there are many of them, and I don't think we should underestimate their own commitment, dedication to serving our people. We want to say thank you for the work that they've done. We want to say as well that we are here to listen and look at what solutions we can bring. I will be down in the Eastern Cape on Thursday to actually deal with exactly that. I was there last week, and I spoke to a number of doctors. Where there are problems, we are always committed to getting them solved. For those doctors who are not employed, if they are qualified and if they are qualified and registered, in South Africa, then of course they should approach the Department of Health. Right now, I'm sitting with a distribution list of all the community doctors in service, all the interns in service, and all those interns and community service who were to carry over and start after July. All of them have been placed as far as we're aware. So if there's anyone who does not have any placement, let them approach our ministry. Let's see what is the problem. But sometimes you hear the stories of doctors who are unemployed. You only find that some of them have not been registered because of the inadequacy of the training and maybe not being able to go through the exams and all of that. So when we generalize, it becomes difficult. Last time, I actually invited the Medical Association to bring all the lists so that we know who are we talking about. As we speak right now, we employed as many as were available during the peak, and therefore we would want to know where to get, where are those that need assistance. But where we sit, we would say those who wish to serve, we are really prepared to get them to come in and serve. And in the other, in the provinces, in the various provinces, like in the Eastern Cape, and as we've seen this in the Western Cape, there's a lot of movement of staff. So when the posts appear in the province of somebody's residence, they move back to those areas and have to start filling those posts again. Some of the people look at whether the post is contract. If they got into a contract post and a permanent post appears somewhere else, they resign and move over. So this movement is something that you have to manage every day.
Minister, thank you very much for your time this evening. That was Dr. Zweli Mkhize, our Health Minister, responding to some of the concerns raised by our reporters covering the public health system across the country.